Pregnancy and Birth the Truth will tell you everything you need to know about pregnancy, birth and beyond. You'll get the facts from our experts, midwives and doctors, as well as essential words of wisdom from the women who've been there and know the truth.
Around the back as well.
Coming up in this programme, how to make a belly plaster, a permanent reminder of your pregnant body.
It's okay. I survived that.
The first stage of labour and how to deal with it.
Back to the indelible lipstick.
Phoned the hospital and they said, oh yeah, first time mum, call us back in a bit.
Didn't want to be touched or talked to. I couldn't really answer a question, I was so far away.
And how your baby grows at 35 weeks. But first, sticky eyes.
To put it politely. Yeah.
Newborn babies very commonly get what we would call sticky eyes after birth, but not all babies with sticky eyes have conjunctivitis, which would mean an infection of the lining of the eye, the conjunctiva.
How long has he had his eyes a bit sticky for?
His eyes have been like this since he was in hospital, but
Was he?
yeah, it's kind of, the other one's caught it now as well, on this side.
I think it's got worse recently. Yeah.
The hospital gave me some little sachets of saline,
Yeah.
but we've run out now. And Rob went to the chemist to try and get some, but we couldn't. All they had was contact lens solution.
The reason a lot of babies get sticky eyes is because the tear duct doesn't work properly in the first few weeks of life, and those babies simply need their eyes bathing to get rid of the stickiness, which is more commonly seen in the mornings after they've been asleep, or at least for some of the night. But a baby with sticky eyes should be examined to make sure the conjunctiva or the lining of the eye isn't red and inflamed, and if it is, we suspect conjunctivitis. So we take a swab of the eye to see if there were any bacteria in it and treat it with eye drops or ointment, usually for 7 days, and then it would clear. And usually that does resolve with time as the tear duct becomes bigger and functions better. In very rare situations that will be prolonged, and then we'd probably refer the baby to an ophthalmologist for a more thorough assessment of that.
Now you can sit down. You're nicely greased up.
In the final weeks of pregnancy, some women may choose to create a lasting memory of their pregnant state by taking a plaster cast of their belly.
There are people who do it. You can go to the studio and get it done.
You'll need packs of prepared plaster of Paris rolls cut into 12-inch strips. These can be bought at most art stores or handicraft shops. A very large pot of petroleum jelly, 1 bowl, warm water, plastic sheeting and an assistant. Start by smothering the area to be covered in a thick layer of petroleum jelly. Then moisten the strips one by one and lay over the prepared area. Cover the front of the body completely and recover with more strips until there's a good layer of plaster. Ensure that there's enough room to get out of the plaster when it's ready. Wait until the plaster has hardened. The plaster will warm up, but shouldn't get too hot.
It's about half an hour later.
We're going to take a chance on this.
Because I'm cold.
When it's set, remove carefully and allow it to dry further.
My God, I'm enormous.
The cast can then be decorated with information like the baby's date of birth, handprints and so on. You'll then need a soapy bath to remove the petroleum jelly. During the final weeks of pregnancy, many women will experience contractions. Sometimes for a couple of hours, but eventually they wear off. But when labour really starts, the contractions will become regular and increase in intensity and frequency.
Went to the cafe, ordered some lunch, but I really didn't feel that hungry. But I thought, oh, I need to eat something to keep my strength up, so I'd have a sandwich and a cup of tea. And while it was a very small little cafe, and when we initially went in, there was nobody there. But by the time we were about to leave, it was full. And in the meantime, I had been contracting the whole way through and having to just stop what I was doing and bend over on the table and breathe. There was quite a number of eyes on us, wondering what the hell was going on.
Initially, the contractions may feel more like period pains. This helps the cervix to thin, and as it does so, it's gradually pulled up over the baby's head.
And despite the fact we're 2 minutes apart,
No.
and lasted 35, here we go.
That gave me
She's
enough
still doing
to
her
put
makeup.
concealer on and lipstick. Oh, this really hurts.
And there was a young waitress who just happened to come when I was having a contraction, and she said, "Are you okay? Are you okay?" And Val said, "It's okay. She's in labour." And the poor girl's face just dropped. But she thought I was going to have the baby there and then.
Thought I'd better time these contractions because isn't that what everybody does in the movies? So I started doing that, and they're sort of 5 minutes, then 8 minutes, then 5 minutes. So I thought, oh, bugger this, you know, I'm going to go and do the hoovering. So I did the hoovering.
It really is like climbing a hill, isn't it? It's like you really fight to get to the top, and then when you're there, you're really knackered, and then you come down the other side, and it's really great.
The first stage of labour is set to take place from the onset of regular contractions and increasing cervical dilatation until there's no cervix to be felt on internal examination. During this time, the baby's head will descend further into the pelvis.
And I went to my mum's on the Thursday night whilst I was having the contractions. I didn't want her to know because otherwise she would have got a bit, panicky. So I just sort of breezed through them. And I was up all Thursday night. I was phoning the hospital saying, okay, well, now they're 4 minutes apart and they're lasting between 30 and 40 seconds out. Right, just have a bath. I think I had about 3 baths Thursday night.
I poured myself a glass of wine. Didn't drink any of it. I think I had a couple of sips, but I drank some of it.
There's no specific timeline for the first stage of labour. In some women, it may be very short, as little as 20 minutes, and for others, it can continue for several days.
Just sort of started getting things ready, made sure that, I had some cake in the kitchen that I'd baked, and because there were going to be quite a few people there was going to be my doula, obviously the midwives, there was somebody filming it, there was Mark, there was both of my parents in the end came along as well.
It's more likely that women who've had previous babies will have a shorter first stage, but that's not always guaranteed. When dilatation of the cervix gets to about 8 or 9 centimetres, the woman experiences what is known as transition. This can be a very tiring time for her as the contractions are very strong, and yet she's not ready yet to push her baby out.
And then I just thought, you have to give in to the pain because I think your natural reaction is to fight pain, is to get through it, but you have to actually relax and let it happen to you. And something just clicked, and I just thought, I want to get in the bath, and I ran a warm bath, and I spent almost all of my labour on my own, kept topping up the warm water, and I had various blow-up pillows, so I could just lay down in between. And then when a contraction came, I just bent over the bath and just spent the whole time in there being completely silent. And I just thought, I really didn't want to go to hospital, so I thought, you don't know what stage you're at, you don't know what level of pain you're at, you just have to keep coping.
Finally, her cervix has dilated to a full 10 centimetres, and she can then start to birth her baby. This is the second stage of labour. By 35 weeks of pregnancy, your baby is getting very close to be ready for birth. There are only 5 weeks to go. Its lungs are developing rapidly, and you may feel your baby having hiccups, which is how your baby exercises its lungs. The amniotic fluid that the baby floats in has built up to just under 1 litre, and the baby can now coordinate its sucking and swallowing reflexes. Mucus has started to move down the gut lining and is building up in the lower intestines as meconium, the thick, tarry poo that babies pass in the first few days following birth. As the baby has grown so much, there's little room for it to move as easily, and it should now be lying in a vertex or head-down position. It's at this time that your midwife will be more concerned about the position of the baby. If it's lying in a breech position in another week, she may well refer you to an obstetrician to see if the baby can be moved. If the baby is born now, it will still be classed as premature, but it shouldn't have too many problems with breathing or feeding. It now weighs 2,150 grams and measures 43.5 centimetres. Coming up next, packing your bag for the birth of your baby.
I did say to myself a month ago, I said I must get my bag ready to go, and as you know, I'm due tomorrow and he's still not ready.
Essential words of wisdom from Daisy about crying babies.
You know, if they know you're going to be there as soon as they start crying, then they'll do it constantly.
And preeclampsia, a dangerous condition which affects 5% of all pregnancies.
Well, we know the cause is related to the placenta, and we know the cause is related to the way the placenta attaches to the wall of mum's uterus early in pregnancy.
And the problems that may arise from a posterior positioned baby.
Feel whether that's the back I can feel or... I did say to myself a month ago, I said I must get my bag ready to go, and as you know, I'm due tomorrow and he's still not ready.
Just starting to get things organised for the baby. Andrew suggests a basket of stuff to be had in the room, one for the baby and one for the mum.
We're packing the transfer bag in case we need to transfer to the hospital.
Yeah.
And I've put in my pink pyjamas and my new slippers, all the maternity bits and disposable pants.
Yeah.
Saggy old nursing bra, should be nice and comfy. Old knickers. Oh yeah, breast pads, always useful.
And my toothbrush and my toothpaste.
Oh, these are a couple of pre-fold nappies which are to use instead of maternity pads because they're so much softer and so much more comfortable to wear than nasty icky paper maternity pads.
And now we're putting in stuff for the baby, for Lilac. 2 nappies and a wrap.
Very cute little nappy.
Some liners, we'll just put a few liners.
Yeah.
Little first size suit.
Blanket.
Some wraps for the nappies. Plain white one I'll probably go for as the first one. But this one arrived in the post the other day. Excuse my pile of laundry in the background there, it needs sorting. And I just think it's absolutely gorgeous, but obviously only for a girl. I'll do a pot of olive oil, a little tiny pot of olive oil, because if you put olive oil on the baby's bottom before you put a nappy on, it stops the meconium all sticking to their bottom, which is horrible stuff to get off. It's like tar. I have been very extravagant. I have bought 7 pairs of pyjamas. 1 pair of pyjamas for every day that I intend to stay in my pyjamas after the baby's born.
It's difficult, but let them cry. Really, I mean, obviously, if they start getting panicky, then obviously go and get them. But I mean, there's nothing worse than having a mummy's boy. You know, if they know you're going to be there as soon as they start crying, then they'll do it constantly. And because I didn't do that from the word go, he's quite happy to lay on his mat and just, you know, talk to his animals. And, you know, he'll sit there and have a laugh to himself.
So basically, don't fuss over them.
Yeah, really don't fuss, don't smother them. I mean, yeah, you know, when they're first, but well, all the time, you want to cuddle them and love them all the time. But it makes it worse. It does, it makes it so much worse. Because then they'll expect it all the time. And it'll just, you'll never be on your own. You'll constantly have them on your hip. So that's what I do. And just enjoy them. Enjoy them because, you know, they're only... I mean, he's 2 months old and he's already in 3 to 6 month old clothes. So they grow so quickly. And it's, you know, he's not a newborn anymore and it goes really quickly. So just enjoy them when they're tiny.
Well, preeclampsia is a fascinating condition. It's diagnosed by, in a previously healthy woman, finding high blood pressure and protein in her urine in the second half of pregnancy. And both of those things clear up after the baby's born.
Preeclampsia is just one reason why consultant obstetrician Des Holden must record the blood pressure of all of his antenatal clients.
Best today. The name of preeclampsia, the pre part, means that there is something that is more severe, and that is eclampsia. And eclampsia is defined when somebody has convulsions in relation to their blood pressure and their complication of pregnancy. And eclampsia is a very serious condition, and there are a few deaths in the UK, and within the world there are many deaths in relation to eclampsia every year. It tends to affect about 5% of women in the average obstetric population in the UK. It's more prevalent in certain other areas of the world, interestingly. It's much more common in first pregnancies, and it's more common in first pregnancies per partner. So somebody who's had preeclampsia with one partner and then perhaps had another baby where she had no preeclampsia, if she changes her partner, she can have preeclampsia again. So it's a very interesting condition. It's a condition which we see reflected in mum's health and also in the baby's health. So on the mum side of the placenta, we see a woman who often has high blood pressure, who may be a little bit more edematous and swollen, who has protein in her urine, and maybe has some subtle abnormalities of the way some other organs are working. In the baby, we often see a baby that's a bit smaller than we would expect, and there are ultrasound tests which we can apply to small babies which suggest that they are small and want to be bigger rather than just happily small. Okay, this is the placenta. This placenta's at the top of the uterus, which is great. Well, we know the cause is related to the placenta, and we know the cause is related to the way the placenta attaches to the wall of mum's uterus early in pregnancy. So although the condition only reveals itself later in pregnancy, it's certain that it's to do with events early on in the pregnancy and the way that placenta attaches. There isn't really a treatment for preeclampsia, and what we would teach our medical students is that the only treatment is to deliver the mum. Now, of course, if the preeclampsia comes on quite early in the pregnancy, we would try not to deliver, but try to get further gestational age in that baby so that it is stronger and more developed in order to be born. So the nearer the end of pregnancy that the preeclampsia comes on, the more we would deliver that woman when we have made the diagnosis. There's lots of exciting studies going on as to whether the risk of preeclampsia can be modified, whether we can take someone who's at high risk of getting it and prevent them from getting it. And there's lots of interest in using vitamins to prevent that, and the vitamins of interest are vitamin C and vitamin E. And these are a group of vitamins that are antioxidants, as anyone who goes to health food shops would know. And there's a lot of excitement about whether that can increase the gestation at which preeclampsia comes on.
Vitamin C isn't stored in the body, so you must ensure a daily intake of foods high in the vitamin. These are broccoli, tomatoes, papaya, mango, red, yellow and orange peppers, potatoes and kiwi fruit. It's best if you eat these vegetables and fruits fresh or frozen. Tinned vegetables and fruit tend to lose a great deal of the vitamin content in the canning process. Vitamin E can be stored in the body, and those foods high in vitamin E are vegetable oils like sunflower and safflower oil, green leafy vegetables, spinach, broccoli, kiwi and mango. Nuts also contain vitamin E, but you may need to avoid them if there's a family history of nut allergy. Both these vitamins are known as antioxidants, which help to protect the body against free radicals, which are a byproduct of the oxygen that we breathe, and free radicals can affect healthy cell growth. There's also evidence that these vitamins can help to eliminate heart disease and certain types of cancers. Some 11% of all babies will lie in what's known as a posterior position. That is, with the baby's back lying against its mother's back, with its head down in the pelvis. More babies will be found lying to the right side rather than the left.
I'm just trying to feel whether that's the back I can feel. Or...
Sally is 7 days overdue, and her midwife, Aida, has arrived to give her a checkup. Sally's baby is lying in a posterior position, and Sally has some concerns about this.
Have you got any views about it being posterior?
Yes, I'm trying to be very relaxed about it.
But I don't think I am very relaxed about it. Just because that was the main reason I was given for Luke's failure to progress. Although I know that it was also because he wasn't ready to be born. He was OP. It was extremely painful, the labour.
It's preferable for a baby to lie in an anterior position, with the baby's back on the outer wall of the uterus, as when the woman goes into labour, it appears to be less painful and shorter, although that can't be guaranteed. There are some steps a mother can take to encourage her baby to turn into this position, like spending time on all fours or leaning forwards over a ball or chair.
And I'm trying very hard to sit in all the right positions and do that. But then again, I have the pelvic pain, which makes sort of this position quite painful after a while. So yes, I'm vaguely worried about it. I wish she wasn't, because she's been LOA the whole time until 2 weeks ago, or 3 weeks ago. But maybe that's just the way my babies grow, you know?
There might be a reason why she needs to be there.
I was a little concerned, as I said, because I feel that there's very little room for her to move anymore. It feels very tight and very hard. So I'm only concerned that she won't be able to move around again because there's so little room for her to do it. But, you know, I just think that, you know, if I spend an hour sitting like this and an hour sitting like that, it's just as likely that she'll go back again.
If the baby's going to stay that way, it will stay that way, and there's nothing you can do to actually stop it.
If the baby doesn't turn anteriorly, it can still be born whilst in this position, and many babies rotate during labour.
Tell me where the baby's lying now.
Baby's lying on the left. Baby's back's on the left, which is so brilliant. I thought she turned yesterday, actually. I've been doing lots and lots of lying on my left, and, you know, when I watch telly at night, it's very uncomfortable. I get a numb leg. And then I was in the pool last night, and she's moved around. Clever girl.